Join HealthClick on an evidence-based educational journey into applying the principles and philosophy of PNF to enhance gait. The concepts and techniques presented in this course provide clinicians with the information and hands-on skills necessary to address the ambulatory needs of their orthopedic and neurologically impaired clients in all therapy settings.
We're going to start taking those basic principles and the patterns of PNF in addition to other treatment techniques, and we're going to be putting that together and looking at application to patients. And we're going to look at progression, we're going to look at choice, and being very specific about our decision of what is it a patient needs to address the particular thing that they've come in to see us for. What you're going to learn today is applicable to all different types of patients. Anyone from the comatose patient in an intensive care unit to a patient who has come to see you in an outpatient setting for more of an orthopedic condition and maybe is trying to train for a triathlon. So you can take the content from today and apply it to whatever treatment setting you're in and whatever level your patient is at.
Evidence-based research studies and clinical scenarios provide the efficacy of the PNF approach when applied to specific musculoskeletal and neurological dysfunctions impacting functional gait. Engage in problem-solving scenarios that identify specific PNF techniques and patterns that can be utilized to address each issue before pre-gait and gait activities. Learn the 8 components of PNF philosophy and incorporate each component into a comprehensive treatment program. Explore the importance of each component of PNF basic principles and understand how to apply each principle to obtain better outcomes. Learn to identify a patient's potential by applying the appropriate demand on their system. Perform scapular and pelvic patterns to promote specific functional movements for pre-gait and gait activities. Learn the consequence of abnormal pelvic motion in the gait cycle and how to address each deficit with specific PNF techniques. Develop a treatment plan that is progressive and sets the patient up for success by incorporating many critical components of the PNF philosophy and principles into a comprehensive program.